That's great. Let's start. You people. First will always be serum squamous, and after, when you feel that you are saturated with serum squamous, now you want to revise something else. I'll use the term revision now. So you should be focusing on thyroid, and after you do with your thyroid, third thing will be your CA oral cavity and CA larynx. These three things basically you have to be ready. And this can also be asked as a short case presentation because there are multiple examination methods, multiple maneuvers which are used over here. So in today's discussion of next 50 minutes to 1 hour, we'll be discussing the OSCEs which have already been asked from this session. One. Second thing will be the possible potential OSCEs. Two. Third thing will be case presentation, but not exactly that traditional case presentation because we all have been through. So we'll be basically discussing today. Basically, we'll be discussing the questions or the viva points that are that you should include in your history, that you should be ready to answer for your examination and viva. Okay, so without much further ado, let's start with this thing. See, we shared this image in the group, and here I have just put the essential parts so that you should be aware that these questions have already been asked and similar kind of questions will be there. So I'll go ahead with this thing. A 48-year-old lady came with complaints of swelling over the anterior part of the neck, and which she noticed about a month ago. FNAC suggestive of calcitonin found to be positive. See, so basically you have to be on the look for this is calcitonin. Okay, entire thing is there in your image. This is calcitonin. So basically you have to be on the look to find the keywords. So जैसे ही you see calcitonin, so what will be the answer? You have already answered in the group. Dr. Ridhima, what shall be your take as soon as you see calcitonin?
The medullary carcinoma.
Medullary carcinoma. Just a minute. ये earphone नहीं connect हुआ. Yeah. ठीक है. So your answer is your medullary carcinoma thyroid. Okay, so you stand ahead with 1 marks from this question directly. Now the second question states that what are the two syndromes associated with this thing? So we all know MEN 2A, MEN 2B, familial MTC, all these things will be associated with it. Similar things will be asked to you in the viva itself, and as soon as you utter this word MEN 2A, MEN 2B in viva, okay, so be ready to answer the components of it. Okay, now coming overhead, second question, name the genetic mutation implicated in the pathogenesis of the above disease. We all know what is the answer. This is red gene. Okay, and again moving ahead, name two other immunohistochemistry for the above disease. One is already calcitonin, which they have mentioned above. So apart from calcitonin, what it can be? It can be CEA.
And chromogranin.
Yeah, chromogranin A. Anything else which you are aware about? Because Scott Brown mentions only these. Okay, and apart from this, they have asked 2. Okay, so we are already answered 3. So जरूरत नहीं है. And what is the targeted biological therapy for this pathology? The answer goes to be
dasatinib,
vandatinib, and cabozantinib. I'll share the screenshot also from the Scott Brown itself. These 2 names are given. Okay, vandatinib and cabozantinib. Okay, and one additional thing, when you'll be discussing medullary carcinoma of thyroid, this will be your viva question. What is the role of thyroid surgery? That is hemi versus total in medullary carcinoma thyroid. Okay, so it's given as a short paragraph in your Scott itself. So please go through it. Okay, so one thing is over. So clear about medullary carcinoma of thyroid. Now, see, why is it important? Now, can you see the similarity of these 2 images? I'll try to bring it in one focus. This one and this one. Are they same? So that's it, है ना? They have this question is from your August 23 session, okay? And so they did not ask similar kind of question in the previous one. So you are liable to get one thyroid image this time, है ना? Medullary हो गया है. If medullary is not asked, the second most common will be papillary carcinoma of thyroid. They'll give you an HP image from papillary carcinoma. They can give you an HP image of psammoma body and ask to you what it is, where is it found, which all other conditions they are found, है ना? We'll be sharing this papillary wala HPE and psammoma body wala HPE also along with it. Okay, and one thing also apart from it, so medullary carcinoma of thyroid, we'll like put it aside as of now. Coming to this second question, so there's no fun in telling the condition is thyroglossal cyst. Okay, pathophysiology again we discussed. You answered it correctly. What is the name of treatment of this procedure? That is cyst trunk operation. Okay. Now the problem will be what surgical steps will you take to prevent its recurrence? Okay. 1, 2, 3 are okay, na? Is anybody having any doubt in 1, 2, 3? No, na? Okay. So what surgical steps will you take to prevent its recurrence? Now, can we have somebody again to break the monotony and help me out?
Removal of the base.
Base of tongue. Okay, good. पूरा base लिखना है. कौन सा base remove कर रहे हो? है ना? Okay.
Okay.
What else will you try to remove?
Remove the anterior part of hyoid bone. Jet tract.
Anterior part of hyoid bone. Good. And one more thing. अभी और बोला डॉक्टर अभिनय बताइए.
Body of the hyoid bone and the
body of the hyoid bone. Exactly, है ना? So these three things when you add in your normal routine cyst trunk procedure, so it becomes the modified cyst trunk procedure.
Sir, is there a particular measure this much mm we should remove?
No. ऐसा कुछ नहीं है. See, coming to the practical point of view, that depends upon the.
So actually, that was asked Viva once. So that's why.
These questions are basically depending upon the examiner who is sitting in front of you. Okay, so these people are very experienced. They have 20, 25, 30 years of experience after PG. We are fresh into PG. अभी हम exam pass कर रहे PG का, है ना? So they will be discussing these type of questions which might be given in some journals, which might be given in some Second, what they are practicing, they might ask the same thing. Acha, what you are asking ki how much muscle tissue to be removed, na? How much tissue? ठीक है. I'll just check on this. Scott doesn't say anything about it. Stelmanen doesn't say anything about it. And third is coming.
They asked about the how much amount of hyoid or about like what is the measure of the hyoid that you will remove from where to where.
I'm unable to hear you, sir.
Just a minute. You're not able to hear me? Guys, are आवाज video and audio, are you okay with that?
Yes.
Hello? Okay, na?
You're audible, sir.
Okay. I heard somebody said कि you're not audible. Okay. ठीक है, I'll just have a look again. ठीक है. As far as like my residual knowledge is concerned, these books doesn't mention about anything about the how much you have to remove. Okay. So I'll check on that. If we get something on the literature, I'll share with you guys. Okay.
Extent is asked, not dimensions. Extent is asked.
So extent is given. Na? Extent to you will say that we'll not only remove the cyst, you will track the whole duct and a pura tissue around it that you will remove. The extent so you can answer about it, right? But that how much tissue is to be removed, that is entirely different.
To me, particularly the measure was asked.
See, basically speaking, now they can ask you anything. I've told,
yes,
be prepared for this thing. Okay, don't get bogged down by this thing that you are not able to answer that one fine thing that someone is asking. This shouldn't deter your confidence. So be ready for these things. These will be the bouncers which will be coming. Okay, don't worry. And coming to the last question of this thing, what is the most common malignancy? Which see, this you will occur na when you will come on this side of the table. Okay. The one जिसको like you have to make them feel कि तुमको कुछ नहीं आता है. This happens in every viva, whether it's your institution viva or it's there in your final exam viva. Okay, so don't worry. Okay, what is the most common malignancy? So who will give me again किस में कौन सा malignancy आएगा?
Papillary carcinoma.
Yeah. ठीक है. So this is your papillary. आराम से. हाँ. This is papillary carcinoma, thyroid. And when coming to the percentage, this is 1%. ठीक है, this is given in your Scott. ठीक है. अच्छा, इसमें there is one additional thing which is not given in this. I came across in a PPT. This is known as Shelang procedure. What is this Shelang procedure? Okay. This is a ancient vintage thing. Nobody practices it. This is basically simple excision or removal alone. Okay. So these are the things of history before this wrist trunk operation was named, and this was the name which was given to this surgery. So just keep it on the back side of your mind. Shelang procedure करके कुछ होता है. ठीक है. Moving ahead. So इसमें से कुछ अलग से नहीं पूछेंगे. I just searching around what else thing can be there. So images, you are okay with this thing. This can be there. What are the commonest site है ना? So you should be remembering this subhyoid is the commonest. Apart from that, they might ask कि और कहाँ पे होता है, so you can answer with this thing, and nothing apart from that. Coming ahead, ठीक है. This is the slide mentioning the DD of midline swellings of the neck. That is ये. चलो, coming to the next question, guys. See, we all know that as soon as we get a thyroid patient, we'll tell him to get a ultrasound done. And see how this question will be asked to you, that when you present your case of thyroid, so after completion they'll say how will you manage the case. So you say that, sir, I would like to do a thyroid hormone test. So second question over here is, which thyroid hormone, please listen to me very specifically, you might be knowing the answer, which thyroid hormone will you ask specifically अगर आपके पास एक ही option है. If you have only one option left, which one will you ask? T3, T4, TSH or something else? Free T4 है ना? TSH, TSH. TSH, ठीक है. इसमें confusion नहीं रखना. ठीक है. See, my idea is not to go into the pathophysiology of thyroid, क्योंकि that is for physiologists to study. Like what is our aim to write everything in the viva exam, pass करके बाहर आना है, and ultimately thyroid surgery करना है. As a fresh resident, hemithyroidectomy करना है, and जो बड़े center में काम करेंगे, they will be doing total and multiple other cases. Okay, so pathophysiology पे अपन I will not go much into it. Answer, it will be TSH. Ultimately, what we do, अगर आपके पास you have everything available with you, you will do T3, T4, TSH, everything. But if examiner asks specifically that only one test you want to do, one blood test, so answer will remain TSH. Okay. Chalo. After TSH, what you will advise to the patient? You will advise please get a ultrasound of your neck, of your swelling done. So, and in ultrasound, what you will be looking for? You will be looking for the thyroid screening. Now, who will help me with the full form of thyroid? This has already been asked in OSCE itself. And second thing, वाइवा में तो पूछते हैं.
Thyroid imaging and reporting data system.
Yeah, that is absolutely right. Thyroid imaging and reporting data system. Okay, so iska full form you got it. Now, second thing is, see, for exam purpose, you should be remembering it that this ACR stands for American College of Radiology. Okay, this thing, just remember it. Okay, that they might ask you that what all will you look in these thyroids, what will indicate you. The first thing is why thyroids is basically done. Thyroids ka one main thing is ki whether you want to do the FNAC or not. It depends upon the grading that what you get, one. And second thing is what will be the fate of this thing, whether you want to keep her on follow-up itself or you want to do FNAC or something else. Just a minute. Welcome, Dr. Priyanka. ठीक है, तो ये will not like go into depth. Please ratify it if you have not remembered it. 2-3 points are there, like what else, what marks will you give? If they want to go into details of thyroids itself, they will dig you into this only. So remember this, okay? And as soon as you utter thyroids के बाद they'll ask you what you will do next. You will say FNAC, and FNAC में what is important to you, that is Bethesda. So please remember the grading of Bethesda also. That I'll share that in the PPT or PDF itself. That in what class, how many percentage, कितना percentage है कि that this will turn into malignancy. That percentage is important for you in Bethesda. Okay. Now this third thing is कि how will you suspect whether this patient is having malignancy or it's just a plain thing. So don't just directly jump कि sir, just a minute. Welcome, Dr. Raj. ठीक है. So see, these are the things how you should modulate your examiner and sit for more time, answer more questions in front of the examiner. Like suppose if he asks you that how will you, after the completion of your history and examination, Dr. Saab, do you think whether it is malignant or whether it is benign? So you would have made something in your mind, okay, sir, this will be malignant or this will be a. And if he asks you, then why do you think it is malignant? This can be a common question. This is a very common question, in fact. So you will say, sir, in history these points are there, 1 2 3 4 5. Clinical examination में मेरे को 1 2 3 4 5 ये मिला. And after this, I am planning to do imaging for this patient, and if I get 1 2 3 4 5 these things for my patient, more chances of malignancy are there for this patient. So rather than आप directly आपने 2-3 point बोले कि there is family history or basically age patient का ज़्यादा है, he is a male, there is exposure of radiation, try to always divide it into headings. Same thing applies for the people in second year and third year who will be giving your theory exams as well. Always, whenever you are answering a question, try to divide it in tables, make a flowchart for this thing, and make it appealing to the examiner. Okay, like suppose this is only there, so you have to mention, rather than just making a paragraph out of this thing. This I'm like writing for the people who will be giving their theory exam. Okay, like features of malignancy. So this you can divide like this: 1 2 3. Here you write history, clinical, and here, and over here, tuck 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 tuck, dot wise you'll make it. So this will become appealing to your examiner, and chances of your passing will increase. Okay. So this was the first 3 questions of OSCE over here. Now we'll start with the case discussion part. What things you will be ready to answer in your case. Okay. So let's move ahead. Okay. So छोटा हो जाए भाई. ठीक. So it can be like let's take a virtual case, taking that this is a 25-year-old female, profession is supposedly homemaker. Now here the first question will become resident of. ठीक है. Resident of. Why is this resident of thing important? Because there are certain belts in our country which are prone for iron deficiency anemia. तो यहाँ पे जो भी आपने बोला, suppose example patient is from Gorakhpur, UP. So you are proceeding towards the foothills of Himalaya. One. Second question over here will be asked that you should be knowing is, one thing is iron deficiency में which cancer is there, which cancer is associated with over here? This is follicular. Okay. So guys, in like he might ask you what other places are there which can be, so like you should be remembering, like in Kerala the amount of thorium in the soil is too much. Okay. So in our country, one place you should remember this. Apart from that, I have nothing against anybody from Kerala. Even my roommate was from Kerala. Okay, so please don't take it other way. If anybody is from there. Second thing is your Chernobyl disaster. You all have heard about it. Okay. So all these things were having ionizing radiation. And from ionizing radiation, which cancer is associated? This is
Papillary.
papillary. Okay. So follicular के लिए iodine deficiency है, papillary के लिए ये तुमने ये लिख दिया. So this you have to bring out in history that sir, if the patient residence of the patient might depict the type of cancer which is there. So as soon as he says कि how can you say ऐसा कैसे है? So sir, the people who are in Chernobyl or surrounding belt ionizing radiation में papillary carcinoma is associated. People who are in iodine deficiency areas such as belts of Himalayas and all, so वहाँ पे these things can happen. Okay. So the patient came with complaints of say कि complaints of swelling over the neck. How she noticed? So this you have to mention, which either she noticed or somebody else noticed and told her you are having this type of swelling. So that you can mention. Because generally thyroid swellings are presented in these 2 ways, which she noticed 1 month ago, 1 year ago, whatever history is given, which was initially 1 into 1 centimeter of size, which has slowly progressed to this much amount of size, suppose say 3 into 3 centimeter of size or whatever you want to write. Okay. Third thing will be swelling moves upon deglutition. So be ready to answer the favorite question after this line. What swelling moves upon deglutition? What swelling moves upon protrusion of tongue? Okay. Why does it move upon deglutition? ये सारा इसके साथ आ जाएगा. ठीक है. Then you have to associate that no history of. See, all this history examination part you would have already read from multiple manuals. ठीक है. जो एक we shared in the group, that also contains similar kind of history. So history taking and examination remains the same. The idea about these thing is कि you should be aware about the questions where you can be interrupted and how you should be ready to answer those questions. Okay. So there's no history of difficulty in swallowing or any change in voice. Yeah. So why will these things be asked? So you are ruling out the retrosternal goiter over here. So if the size of the swelling is too much, so definitely so it will cause these types of symptoms. Okay. And apart from that, then you can rule out the other things, the features of malignancy. You can rule out that there is no history of pain associated with the swelling. There is no history of sudden increase in size. So, अगर आप ये सब बोल रहे हैं, तो you are taking your viva more towards the benign size. Okay, so this depends upon the case per se. This depends upon the how you want to present to the examiner. Then comes the very important thing. See, this line is very important for you. No history of hyperthyroidism. This I will say, this line is individual to individual dependent. Okay. How I will approach this thing is, supposedly, see, you will be getting, if it's a long case, it's almost 20 minutes you will be getting in front of the examiner. So the more you speak, the more you discuss with the examiner, more are the chances of you getting good marks. Okay. So if you think that you have too much to say, so then you can cut it short. इतना ही बोल दोगे चलेगा. But sometimes it happens due to the exam stress or multiple other reasons. Our history examination findings are very less. In 5 minutes, 7 minutes, 8 minutes, we finish it off. And again, 12 minutes, 13 minutes, we are sitting idle in front of the examiner. He might ask some questions. He might say, okay, go. So that is negative for us. So these type of questions help us to fill the time. Okay. So if you are thinking कि मेरा history कम है, examination finding कम है, तो यहाँ पे full detail लिखना. If sir there is no history of पूरा hypo का finding डाल दो, है ना? कि there is no history of weight gain, there is no history of hair fall, blah blah blah, सब कुछ डाल दो. खत्म होने के बाद this suggests कि examiner is knowing, examiner will know that आपको आता है what is hypothyroidism. अगला paragraph, there is no history of feature suggesting of hyperthyroidism. तो सारे features आपने डाल दिए कि weight loss नहीं हो रहा, ठीक है, constipation नहीं है, all these things नहीं है कि मतलब polymenorrhea नहीं हो रहा, all these things you should mention over here. And if you think that already I have too much history, I have too much examination, I don't want to waste my time over here, so mention this thing, no history of hypo and hyperthyroidism, and give a pause of 5 seconds and let the examiner ask you, अच्छा बेटा, what are the features of hypo and hyperthyroidism? So you should be ready with that answer. If the examiner asks you and then you are thinking, then you are on the back foot. This shouldn't happen. You should be ready with your bullet. If he asks you, these are the features of hyperthyroidism, these are the features of hyperthyroidism. Okay. If anybody is having any problem in features of hyperthyroidism, I don't think ऐसा किसी को कोई problem होगा, है ना? Please remember it. Okay. And there is no history of hemoptysis, persistent cough, ruling out other thing. Hemoptysis, cough. There is no history of persistent diarrhea. Now again, this is again your OSCE question. Why I am saying it? Persistent diarrhea is associated with which type of thyroid?
Medullary thyroid carcinoma.
Medullary thyroid carcinoma. Thank you, Dr. Chaitra. ठीक है. So आपने जैसे बोला, you said कि sir there is no history of persistent diarrhea. Again, give a pause of 5 seconds. See, whenever you are confident with the the question which he is going to ask, na, so give him that time to ask. Give him the time. You say, sir, there is no history of persistent diarrhea, and wait. If he asks, you are ready. You are ready with your bat. You have to hit sir it is this type of persistent diarrhea is in medullary carcinoma. तो ये तुम्हारा टिक लग गया कि हाँ इसको ये 10 पॉइंट आते हैं तो तुमको 50% मार्क्स से ऊपर ही मिलने वाला है. ठीक है. Now coming ahead, what else you can mention here? No, from my side these things will be okay, and after that you have to mention about the past history. In past history, what, sir? There is no history of chronic medical and surgical illness, blah blah blah. She is not on any medication, and यहाँ पे what else one thing you can do is कि treatment history में if you are mentioning treatment history भी डाल सकते हैं, और you can put in past history also. There is no history of prior radiation exposure. Now, why is this point important? Like in the previous era, like अभी तो everything is much advanced. Previous era में he might ask you कि why did you ask this question? So, sir, radiation can be given for head and neck malignancy and all those things. In sometimes you will see in old books for acne also people had used radiation in the past. So this can be your one point. Sir, there is no history of any prior radiation. Okay. Now coming to again, this is an important point. I'll write in red. So that's why you should be remembering it. Family history. So you should say, sir, there is no familial history, though no cancer related history in the patient. Now he will definitely ask you, Doctor Sahab, what are the familial cancers? So you should be ready with your answer. है ना? So this thing you should not try to remember in front of the examiner. ये आपको पहले से ही you should be ready with this answer. As soon as he asks you, what do you want to ask, sir? Men 1, 2A and 2B. So are you guys aware? Men 1 में कौन सा आएगा? कौन बताएगा?
Pituitary adenoma.
Okay, pituitary adenoma. Hyperparathyroidism हो गया, pancreatic tumors हो गया.
Pancreatic.
ठीक है. See, if you divide it and write ना, तो you will see कि मोटा more or less things are same, things are common. But if you are not confident about it, so you will not utter these words. Then the same things goes for 2A. Again, parathyroid hyperplasia, medullary carcinoma, thyroid, pheochromocytoma. One thing extra over here is pheochromocytoma. Pheo is important. Okay. And same things goes with 2B. And 2B में your medullary carcinoma आएगा,
medullary thyroid carcinoma, Hirschsprung's disease.
Great. है ना? And mucosal neuroma आएगा. Great, Dr. Priyanka. And see, यहाँ पे you are good to go, है ना? इतना अगर आपने बताया तो अब passing marks से तो we are ahead. Now he might ask you any other familial cancers you know, है ना? तो you should answer about एक Cowden syndrome होता है ना? And there is one thing called as Gardner syndrome.
Gardner.
Okay. From where I am putting these questions, see, one is from like जितना last 5 years I've seen the questions वहाँ से include किया हुआ है. Apart from that, I have taken help from 3 videos from YouTube. One is from the TMH Viva for the super उनका questions include किया हुआ है. Second is this multiple videos, small videos from by Dr. Professor Chintamani. ये surgery वाले doctor है, not from ENT. Delhi people would be knowing him. है ना? तो he puts this type of videos on YouTube. तो उससे जितना भी question I could gather for the PG Viva, I have included it in it. चलो. Coming ahead, if she is a lady, so like अगर if your patient is a lady, so you have to mention about the OBS history also. OBS history. So here you can like mention like what is the last childbirth कब हुआ, age कितना है, blah blah, and menstrual history. Why is it important, menstrual history? Because the this cycle and flow will be changed in your hypo and hyperthyroidism. That is the only one possible question from this thing. Okay. Now again, personal history. यहाँ पे फिर से क्वेश्चन बनता है. Again you will be getting question over here. What questions can you do? You all will answer कि sir, my patient is a vegetarian, appetite is normal, sleep is normal, bowel and bladder is normal, blah blah blah. है ना? So in appetite, you should be ready to answer about what are the goitrogen. Okay. So somebody will help me out.
Sulfur containing.
ये तो पढ़ना पड़ेगा भाई. मैंने भी नहीं पढ़ा. अच्छा, like you have read it somewhere. Like as far as I am concerned, एक मुझे पता है, ब्रेसिकेसी जो फैमिली होता है आपका, इसमें आपका कॉलीफ्लावर, कैबेज, all these things come. So these are goitrogen foods. Okay, and I'll check on this sulfur. Like I didn't read it anywhere. I will just note it down. Sulfur related. Okay. ठीक है, so you should be ready with at least these 2 things, and we'll check on sulfur वाला चीज. And is there any history of consumption of seafood? Okay, so if the patient is having seafood, so basically what happens that seafood is very rich in iodine. So this thing, if the patient is having seafood, this rules out iodine deficiency, like clinically. Okay, and apart from that, no history of smoking, tobacco, alcohol. Basically, thyroid mein these things are not very much relevant. That the importance which we gave to the smoking, alcohol and tobacco in our प्रीवियस 2 सेशंस इतना इसको नहीं मिलेगा इधर पे इंपॉर्टेंस. तो इसके बाद हम आगे चलते हैं. ठीक है, देन यू शुड बी रेडी विद दिस थिंग, दैट इज योर समरी. ठीक है, समरी अगेन डिपेंड्स अपॉन हाउ यू हैव बीन टॉट टिल नाउ, है ना. Like every institution has some separate or sacred protocols, like these all things which we will include. What we were taught is, I'll just write it down according to it, and I just mentioned extra point from those PMH vivas. That is 25-year-old female presented with midline swelling of neck of so and so duration, gradually increasing over past जो भी time है, say 1 year, and with no associated symptoms of hyper and hypothyroid, with no associated symptoms of hyper or hypothyroid, probably benign. बस यहाँ पे ओपन एंड करके you should leave it. Now from here, यहाँ तक आपको जो करना था, whatever you could do in your capacity, you have done it. Now the things are in the examiner's court or in the viva जो ले रहा है उसके court पे. How he wants to say, he might say that what rubbish you have written. Somebody will say, okay, most of the things you have covered. Or if it tells you to add something else, please add something else. One thing please remember in the DNB viva, never argue with your HOD, never argue with your examiner. In MS things are different, but in DNB please don't argue. Whatever he says, yes sir, that's it. उसके आगे नहीं आपको बोलना है. अच्छा, इसके बाद be ready for the questions which can be taken out. तो first question will be taken from here only. ठीक है, कि what are the features of hyper and hypothyroidism. अच्छा doctor, why do you say it is benign? What are the features of benign thing? What are the features of malignant thing? You are ready with your answers. If he says this, divide it and shoot with it. Okay. Next thing, this comes to in your history. Now comes to your examination file. एग्जामिनेशन में क्या क्या इंपॉर्टेंट हो जाएगा. ठीक है, सर पेशेंट इज कॉन्शियस, ओरिएंटेड टू टाइम, प्लेस एंड पर्सन, एंड लाइक अगर आपको टाइम पूरा लॉन्ग केस है तो यू शुड इंक्लूड एवरीथिंग, है ना. देयर इज नो पैलर एक्ट्रेस एडिमा ब्ला ब्ला ब्ला, वो सब कुछ डालना है. बीपी पल्स के लिए हमेशा याद रखना है कि अगर आप बीपी मेंशन कर रहे हैं पेशेंट का, इफ यू आर मेंशनिंग द बीपी ऑफ द पेशेंट, वो यू बी ऑन द लुक कि वहां पे बीपी अपरेटस कहीं पे पड़ा है कि नहीं पड़ा. इट शुडंट हैपन कि यू से सर बीपी 130/80 mmHg, and if he asks you did you measure it, then you have a smile on your face कि no sir I wrote it just like that. तो वो नहीं होना चाहिए, है ना. these things should be taken care in the exam center. Okay, apart from that, you can mention about that the patient is examined in adequate light from front, and this thing was okay. Now after your routine examination of जो long case है, long case में सब कुछ लिखना है. If you are mentioning in a long case, so start with your CVS, CNS, Respi, NAD करके बढ़ते जाओ. Let examiner say कि come to the main finding, come to the local examination. तो जैसे ही says, draw sudden jump onto inspection. Okay, so in inspection basically, sir, there is a spherical smooth swelling midline of the neck of this much centimeter which moves on deglutition. Here one thing which you should mention is your lower border. ठीक है, whether you are able to see the lower border or not, this thing is important. And how is the skin over the swelling, okay, that you should mention. And always whenever you are describing a swelling, those standard golden rules हैं that we have to follow. In the inspection itself we should mention the boundaries of swelling. Like यहाँ पे हम एक hypothetical case ले रहे हैं, ठीक है. So you should say कि sir superiorly, ठीक है, गर्दन में ऊपर सुपीरियरली कहां तक जा सकता है. लाइक विल से कि इट इज गोइंग इतना सेंटीमीटर बिलो हायोइड, Inferiorly, any landmark you can take. Sir, it is going this much centimeter above suprasternal notch. Sir, laterally, so this swelling is going this much centimeter laterally. What you can take? What landmark can you take? Sternocleidomastoid. So this swelling is this much centimeter medial to sternocleidomastoid. और medial में क्या हो जाएगा? Midline तुम्हारी वो तो चली रही है. So this you have to mention in inspection. ठीक है? So over here they'll ask you what questions can be there. One question can be there is what are the swellings which move on deglutition. ठीक है? So what can be there? One can be your thyroid swelling. ठीक है? Something called as subhyoid bursa, thyroglossal cyst. This will move. Okay. Then your pretracheal and prelaryngeal lymph nodes will move. Pretracheal and prelaryngeal lymph nodes will move. Then your laryngeal swelling will move. Okay. And what swelling will not move? Okay. Yeah, when it doesn't move. So here you can answer, sir, when there is malignant infiltration of the disease, then it will not move. When there is a retrosternal extension of goiter, then there is a possibility that it might not move. Okay. So after inspection, let's move to the next thing. After inspection comes your palpation. So your first statement generally remains the same. Sir, patient was palpated from behind with neck flexed slightly. One thing is, and second thing will be findings of inspection are confirmed. ठीक है. And then जो traditional अपनी palpation की वो है कि sir, the local rise, there is no local rise of temperature, there is no tenderness, and same thing you have to just mention it again. कि sir, there is a 3 into 3 centimeter. What things you have to mention? One is your firm. How is the surface? Okay. And third thing is your well-defined margins. Okay. And whether the lower border is palpable or not. These four things again you have to mention. Lower border is palpable. हाँ,
Sorry. हाँ, अभी you mentioned ना कि palpated in little flexed no.
हाँ.
तो some examiner say कि neutral position examine करो. उसका कुछ
exactly. See, here you have to follow whatever your institution follows. Okay, I'll share the links of 3 videos. In all videos, they are mentioning different things. So one thing is what you can do is you can mention कि sir in our institution we follow this one, or second you can mention SDAS, है ना? Please have a look कि SDAS में ये लोग क्या लिख रहे हैं. That you can quote कि sir in SDAS the same thing is written. That remains the standard for surgery. Okay.
ठीक, thank you.
So this will depend. See, these are multiple things which this will depend on patient to patient. Okay, कि like ऐसा क्यों नहीं किया, ऐसा क्यों किया. तो that is like वो theoretical point है reference के लिए और कुछ नहीं है. Once you come on this side तो कुछ फर्क नहीं पड़ता. You all practically speaking all these things are of historical importance. When a patient comes to an OPD, nobody pays any heed to like कि Pizillo's method कर लें, कि Cryles method कर लें, कि Lai's method कर लें. Believe me, OPD में आके तो सीधे उसका अल्ट्रासाउंड ही कराएंगे ना. तो like clinically सब खाली एग्जाम पास करने के लिए all these things are there. उसके बाद तो like you have to just jump into the sea of all these things. Okay. And here on palpation, another point which you have to mention is position of trachea. Why is this important? Because in cases of bigger thyroid swelling, the trachea can be shifted to one side or the other side. Okay, so that is important too. And whether any thrill is palpable or not. Thrill palpate होती है, ठीक है? It is not auscultated. Okay. Okay. Now these 3 names: Pizillo, Cryle, and Lines. ठीक है? In just a minute, I'll write it properly. ठीक है? Like इसको आराम से करना है. You shouldn't confuse कि which method is which, because these are individual OSCE questions. They can be asked in GIF दिखा करके. There'll be a small video and you might be asked which method is there. This can be a possibility. Apart from here, two other signs are there which you should remember. One will be your Pemberton sign. इसका OSCE image will be sharing one, and apart from that, yeah, you all remember that the patient is said ki both arms you will keep it up and like touching your ears, and the face will be congested and all these things will be there. Compression of superior vena cava. So these are potential OSCEs, all these four. Okay, so we'll discuss it with images also. इसके बाद आगे आपका percussion. So basically, it's generally resonant over the sternum, that is there. And again, fourth point, auscultation. यहाँ पे आपका thing आएगा stethoscope, है ना? So if you don't have a stethoscope with you or around you, so please don't mention anything about ये कि sir I felt bruit over the superior thyroid pole. We all remember this thing कि we have to say कि bruit कहाँ मिलेगा? Bruit will be over the superior thyroid pole due to the superior thyroid artery and veins. Okay, so you should be ready कि अगर वहाँ पे stethoscope रहना चाहिए. These are the practical points that you should be aware. Okay. Apart from these things, 3-4 things I would like to mention more. Eye examination. Now, over here, most of the examiner will ask you to summarize your case and what is your final diagnosis. And जैसे ही you will mention, sir, this is my probable diagnosis. Like most of the people proceed with this thing. How will you manage the patient? Okay. Some might ask you that what extra things that you should remember. So those extra 3-4 points which are remaining that we are discussing, and then we'll discuss how we'll answer this question, that how to manage the patient. Okay, so in eye examination, there are multiple signs. Please go through those signs. We'll share those pura PDF I'll share. What is von Graffe sign? That is your lid lag. What is Darlimpe sign? Stellwag sign? There are 5, 6, 7 signs are there that you should remember. Okay, I'll just mention the name. Answer will be attached in the PDF itself. But please remember it. It should not mention that examiner asks you, doctor, what are the signs, and you are giving a stare to the examiner. Oh, sorry, I forgot. You cannot forget. ठीक है. फिर Stellwag के बाद हो गया आपका Joffre, and one more sign is there. I'm forgetting the name. M and N. हाँ, M से Mebius sign is there. Mebius sign is there. N से भी एक sign है that हाँ, that is NF. Navziger sign. Okay. इसके बाद next question which you have to remember is your thyroid का staging. See, T and M. T तो सबका अलग अलग होगा. Every malignancy has T different. Now N is common for everything. I've kept it on repeating. So rectify that N wala staging because it remains the same for everything. Two malignancies where it is different is your thyroid and नेसोफेरेंजियल. ठीक है, नेसोफेरेंजियल कार्सिनोमा. तो यहाँ पे ये थोड़ा सा डिफरेंट आ जाता है ना. So he will ask you कि what is the TNM of this thyroid. So please be ready for this thing. I've attached the ratings in the PDF itself जो अपना उसका है. So go through it and please remember it, है ना. There's no if he asks you and we have a sorry figure out for thyroid, so we are at a back foot. So at least 3 things का staging you should be ready within your practical viva. One will be your thyroid over here, then will be in the CA oral cavity में CA tongue का staging याद होना चाहिए and CA larynx का staging याद होना चाहिए. 3 things you can't afford to forget. Please write it, paste it somewhere, and if you want to study and remember more, after these things are like confirmedly concreted in your mind, then go for your nasopharyngeal carcinoma and hypopharynx CA. Okay. Now coming to this thing, the favorite questions of the examiner. कि अच्छा 1 मिनट कितना बचा है? 2 ठीक है. These 3 pages will remain blank. So we'll discuss कि how will you manage the patient. Okay. Now this is like a multiverse of plethora of questions can open from this place. Okay, how will you manage the question? So it all depends upon your luck and how you have answered and how the examiner's mindset is there at that time. Okay, he can take your viva directly to like RAI on all those things, radioactive ablation करेंगे. From that it can go up to that extent, or it can start from the basics. So अभी as of now we'll start with the basics. How up normal, जिसका एकदम normal viva चल रहा है, how that guy should answer. Sir, I would like to further evaluate the patient. Yes, Dr. Sahab, how will you evaluate the patient? So sir, I would like to further examination. Further examination में you will do the T3, T4, TSH you will do. Then after doing it you will do USG. What you will try to look into USG, we'll try to sort of we'll be on the look for the thyroid rating and wait for the examiner to ask you about thyroids, because everybody knows it. And these are the passing points to cross that 50-60% mark. Okay, so you have got now here, from here he can give you that permutation combination. Okay, doctor, like let me tell you that the patient is having thyroids 3 and now what would you like to do? So be ready with that thing, whether you want to do Bethesda, आप FNAC करा रहे हैं कि नहीं करा रहे हैं. So suppose you have also mentioned about FNAC. Okay, now be ready to answer कि now what surgery will you perform, hemi or total or follow up. So यहाँ पे आपको you should be ready with your thyroids and Bethesda grading. ठीक है, and किसमें क्या surgery लगेगा, that you should be ready. Now one thing is there कि examiner will say कि how will you counsel the patient. So the how to counsel the patient, see in the Bethesda grading we'll remember that हर चीज में इतना malignancy का chance रहता है. So we will explain it to the patient. This is my take, like how I used to answer, या how my teachers told me that supposedly we have to tell the patient कि patient आपका Bethesda grading itna hai, this is your Bethesda grading, and these are the percentage of chances that this might turn malignant. So then he should have we will take an informed consent and then proceed for further surgery or follow-up, because many people will like to be on follow-up itself. They would not like to go for surgery, and few people would be like, if this much is all the percentage of chance, we'll go for surgery itself. Okay, then you will wait for the HPE and the further things that if that thing turns out to be malignant, papillary or something like that. So what will be the further course of action? Whether you would like to do a CT scan or completion thyroidectomy, you should be ready with those things. Okay, these 3 pages are blank, leave it. Now coming to the other questions which are commonly associated with these things. First thing will be your what is the name of इसमें जब भी आप thyroid surgery की whenever you are talking about thyroid surgeries, so steps of thyroidectomy and complications of thyroidectomy, they will definitely be asked too. And third thing is a very common question, that how will you differentiate the parathyroid glands from thyroid glands. This has been a question since like times immemorial and will definitely be asked to you guys also. Okay, so let's start with those questions. 10 minutes more, please bear up with me. Okay, so this is what is the name of artificial parathormone. Please be ready with this thing. There's something called as Ebola paratite. Be ready with this thing. And then after thyroid surgery, you should be ready with they will ask you what are the complications of thyroid surgery. Okay, so whenever this thing is asked to you, always divide it, intra-op, post-op. है ना, सीधे नहीं कूदना है कि सर इट विल बी हाइपोकैल्सीमिया. वी आर वेटिंग कि या तो आरएलएन इंजरी होगा या हाइपोकैल्सीमिया होगा, वहां पे क्वेश्चन इज वेटिंग फॉर यू. बट इफ यू डायरेक्टली जंप अपॉन इट, so like he might get little bit pissed off. Okay, so divide it कि सर intra-op all these things can happen. So post-op में we'll be looking for hypocalcemia, hoarseness of voice, stridor, all these things will be looking for the examiner. And जैसे आप post-op में hypocalcemia बोलोगे, तो hypocalcemia के जो आपके Shostak's and Trogios sign are there, he will ask you what signs will you looking, which you will be looking into it. How will you rectify it? So rectify करने के लिए IV calcium gluconate देंगे. So this has been asked, how will you give IV calcium gluconate? This has been asked in OSCE itself and Viva also. So be ready with this thing. Okay. This question depends upon institution to institution. When do you measure serum calcium is measured somewhere. That same post-op day they mention this is from TMH Viva. So they mentioned कि second and fifth day mention कर रहे हैं. ठीक है. Post-op complications you have mentioned. Okay, how to identify parathyroid glands during surgery? These are some questions over here. Please go through it. Okay, and 1, 2, 3. There's one OSCE called as Partex plane. What is Partex plane? Basically, laryngeal entry point होता है. वहाँ से you some things are anterior to this plane, some things are posterior. I'll share this PDF with you. Please go through this Partex plane. Okay. Okay. So this Shostak sign and this both of the signs remains your OSCE question. Okay, Trojan sign. Please be ready with this thing. And they have given some grading also of Shostak sign. This can be asked in Viva only, not apart from that. Okay. If it comes in OSCE only, so they will ask you what are the symptoms of hypocalcemia, hypoparathyroidism. You should be ready. And what signs are associated with this thing? These are Shostak signs. Spelling, please don't make a mistake in spelling. Hai na? If there is 1 marks given for this thing and you write spelling wrong, तो आधा मार्क्स चला जाएगा. And if the person is too rude and constipated, he might not give that marks also, है ना. तो please spelling Shostak sir देखना है, Projus का spelling देखना है, ठीक है. यहाँ पे mistake नहीं होना चाहिए. And how do you elicit these signs? ये भी पूछा हुआ है कि they will give you an image. How will you elicit it? So you should remember how to elicit this Shostak. कैसे tap करना है, and इसमें how much time के लिए inflate करना है और कितना inflate करना है, that you should be ready to answer. चलो. So इसमें nothing. See, I told you कि multiple. This is like multiverse of questions. This is like ancient questions, like what is AGs, AMES, MACIS. Basically, these are multiple prognostic factors which were used. We were not using them entirely in our institution, so like we have not ratified them. Exam के लिए पढ़ा, exam के बाद पढ़ के भूल गए, है ना. तो please go through these things. Exam के लिए you should be ready with this. What is AMEs, what is AGs, age, metastasis, extent, size, blah blah blah. Please remember them. Okay. So RAI again one subset of your important question for your theory as well as Viva itself. This can be like your OSCE based also. And what you have to remember in this thing basically, when do you do? One thing is this, when do you do? One. Second thing is indication क्या है, वो आपने बता दिया. What is the advantage? Like you want to do, you don't want to do. What are the advantages of RAI? 2. And what steps do you follow before RAI and after RAI? So please go through these things. Point wise mention किया हुआ है. Please go through this thing, है ना, important है. फिर आपका ये हो गया, ठीक है, मेंशन किया हुआ है, ठीक है. This can be an OSCE question. What is thyrogen? Okay, so please be ready with this thing. One question. Now, this question has been asked, like we saw in the first OSCE image of medullary carcinoma, and this is a favorite question. Like if your Viva is turning towards papillary carcinoma, you all these things I mentioned कि ठीक है sir, what do you think it can be? So you answer कि sir, like you go with papillary carcinoma, suppose. So treatment में, like there has been a debate whether you should go for total or hemithyroidectomy or something else. So they might ask you, what do you say? Why is total important or why is less than total should be done? So one thing is what you follow an institution, that you can answer. Second, point wise mention किया हुआ है यहाँ पे. Please go through them and ratify them. This is an important slide. ठीक है. Surgical management of your papillary carcinoma. There is like as things go, there is exactly not a standard single answer for these type of questions कि नहीं we will do this only, because for every surgery or for every surgical intervention certain indications or guidelines are there. So go through these things. So this is important. Hemi versus total in papillary carcinoma. And again this is a very 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 important thing. AGCC 8th में what are the changes? Okay, so apart from things in your oral cavity में जो change किया हुआ है, that they have included your depth of invasion and all, DOI include किया है. These are the changes in your thyroid thing. That age का इन्होंने cut off change किया हुआ है. Apart from that T3A, T3B include किया हुआ है. Neck notes में this change has been there, and there are certain changes in your anaplastic carcinoma. So please go through this thing. Changes in AJCC. ठीक है, stratification अपन ने कर लिया. रेडियो आइसोटोप्स हो गया, फुल फॉर्म ऑफ MIBG, ठीक है. एंड व्हाट आइसोटोप्स डू यू यूज फॉर RI, the radio isotopes that you should be clear about it. Eye science you have seen over here. Now this question, okay, this question has been asked multiple times. They can ask you which triangle are you looking forward to, so be ready with these things. इसके अलावा 2 classifications are there, Cernia classification, Friedman classification. Can I don't want the details of them. कि किस चीज का classification है? Can somebody throw some light?
Superior laryngeal nerve.
हाँ, है ना? तो you should be ready कि what is 1A, 1B, Friedman में क्या अंतर किया हुआ है? Be ready with these answers. This can be a potential OSCE as well as bye-bye question. Cernia and Friedman. ठीक है? And these things have been asked, like I was asked this thing, Jaws triangle in my FAT exam as well as main final exam also. Same question. Okay. So I skipped it in the FAT exam. So we didn't know anything. But when the same thing came in main exam, so we were able to answer this thing. What is Jaws triangle? Okay. Again, same. That's why I remember. The Jaws triangle पूछा था and Wagner and Grossman theory पूछा था as a 10 marks question, and I almost left it blank. And whatever I wrote, that had no connection with whatever the answer. Okay. These two theories are associated with your thyroid glands and all. Not exactly thyroid, basically your abductors and these muscles over there. So Simon's law and Wagner's and Grossman theory, please go through it. Okay. 2 image-based question which will be important. Iska please identify. Who will give it a try?
This is ET tube, which has electrodes, which is used for recurrent laryngeal nerve monitoring.
Nerve monitoring, है ना? So that is the terminology that you should be ready. Nerve monitoring बोलना है. Somebody else, anybody, कुछ और किसी के पास और है option? Let's.
IONM, no sir?
हाँ.
The laryngeal myopathy.
Laryngeal myopathy.
नहीं myography. LMJ.
मतलब basically that's nerve monitoring ET tube, है ना? Terminology you can use anything, है ना? But these 3 terms should be there so that you should get the passing marks. ठीक है? Okay. Okay. And this coming over here, यहाँ पे 2 question है. What is Murphy's eye? Where do you see? And why this radio opaque line is there? Okay. These 2 questions you should be ready. Murphy's eye कहाँ दिखता है? ET tube में दिखता है. ठीक है? This is your Murphy's eye. In the next one also I mentioned the same thing. ठीक है? They can ask you by giving this image, or they can normally also ask you what is Murphy's eye and where do you see it? One, and why is that blue line जो आपका है, that is a radio opaque line that you should be ready. And हाँ जी डॉक्टर सुनील बताइए, कुछ कह रहे हैं आप? ठीक. And over here these are the laser resistant endotracheal tube. And one image I just was not able to include in this thing. I hope you remember that thing. There is an image of ET tube with two of your these 2 cuffs. You remember those image? एक image share किया था. We guys yes, discussed it. कि why what is the function of these 2 cuffs, है ना? So इसके अलावा कुछ endotracheal tube में extra नहीं है. These 5-6 questions were there. And what my suggestion will be, let us keep this entire week for thyroid discussion only. अभी से जो शाम के OSCEs we discuss ना, let us keep daily 10, 15, 20 OSCEs. Whatever I get daily for thyroid itself, will go with thyroid only. And for Friday's class, one topic will include is phonosurgery. And apart from phonosurgery, जो remaining चीजें हमारी रह गई हैं, एक osteology रह गया है, HP रह गया है, audiology रह गया है, और एक बायोस्टैट्स रह गया. मोस्ट ऑल इसको छोड़ करके सब बोरिंग टॉपिक्स हैं. सो वी विल इंक्लूड अराउंड 5 to 10 क्वेश्चंस इन एवरीडे क्लासेस एज वेल. एंड फ्रॉम नेक्स्ट वीक इटसेल्फ, नेक्स्ट वीक में विल स्टार्ट इंक्लूडिंग द इंसिजन्स एंड सर्जरी. 1 सर्जरी डेली. ओके. सो विल बेसिकली 10-15 सर्जरीज हैं, तो विल कवर इट बाय से next week खत्म हो जाएगा पूरा. So this whole week I'll request everybody to you that Sioms Commerce, please इसको make it your bread and butter. Ramayan, Gita, Quran, Bible, whatever you want, read it. Nothing should remain from this thing. Sioms Commerce से कुछ नहीं बचना चाहिए, है ना? Any doubts, we'll be discussing it. अभी इस हफ्ते के लिए we'll be discussing entirely this thyroid. इसमें whatever the OSCEs from your anatomy point of view, physiology points में like hardly 2 or 3 OSCEs will be there. Most of them will be from your examination. How do you examine the thyroid gland? And management में आएगा पूरा, है ना? Like what are the USG findings? Bethesda में क्या है? What is tennis? What is rose? There are multiple mnemonics over here. Like there is something called as tennis, which is thyroglobin elevated negative इस करके है. So we will discuss it slowly and keep accumulating it, keep assimilating it, keep digesting it. It shouldn't happen that you read too much and 2 दिन बाद सब भूल जाओ. So basically that is useless. So give and dedicate this week. Sioms Commerce, you should read daily. This is my humble submission. Take out 15-20 minutes, half an hour, whatever time limit you are getting it. Give some time, give respect to Sioms Commerce. You will give respect to Sioms Commerce. Believe me, after exam, you will feel so much relaxed. But if you will take Sioms Commerce that I'll read it before the exam, 2 days before I'll read Sioms Commerce, so believe me, you will get stuck at many places. Because Sioms Commerce is I'll say it's an Indian Ocean or ocean type of thing. इतना questions है कि मुश्किल करेगा if you will not revise it, and you will come to know your weaknesses only when you face them, है ना? So you have to read it and then only you will decide कि भैया अभी मेरे को Samuato नहीं पता, मेरे को Chloe classification नहीं पता, ENT OSCE नहीं पता, so then you will work on them and then you will remember it. But if you will read it for the last week कि exam से एक हफ्ते पहले पढ़ूंगा, तो you will not even reach till Mary's index only, तो फिर ये surgery वाला तो you forget about it. Okay, so give half an hour, 15 minutes, 20 minutes daily to Sioms Commerce. If not daily, alternate day, है ना? But don't इसके ऊपर time नहीं छोड़ना इसके लिए. अभी इस हफ्ता this week entire till Sunday, give your time to thyroid. जो आप extra time 1 hour 2 hour निकाल सकते हैं. Finish it off completely. And next week से जो भी remaining आपका head and neck और skull base का बचा हुआ है, will focus on that. Okay. So any point from anybody of you? थोड़ा सा आज लंबा चला गया class. Please forgive me for that. Any point from anybody? चलो कुछ अगर रहता है तो drop me a message, है ना? See you on Friday.